next up is, again, another HIMSS veteran, someone who was not only at HIMSS as an attendee, but also as a speaker and a global executive from HP, and someone who understands health IT as well as anybody in the world. And Fran, thank you again for joining us today. How are you and where are you?
Yeah, sure. I'm so glad to be here. Thanks for having me. Participating from sunny San Diego, California.
Sunny San Diego, that's outstanding. Which neighborhood in San Diego? I've spent a lot of time there. Are you closer to Balboa Park, or are you closer to Pacific Beach, or where are you?
No. I'm more inland, the Poway Scripps Ranch area, which is a lovely area of the city.
Beautiful. Okay, we'll have to introduce you to Don Jones later on. He's also from San Diego. He's actually a San Diego native. He's been there his life and come to the Qualcomm and has done a bunch of
he's from Qualcomm, from Dan from Qualcomm Life. Who doesn't know him?
Yeah. So you were also at HIMSS, and again, not only as an attendee, but also as a speaker, and really interested in hearing first about your background. Maybe you give us a couple of minutes overview of your career and just how extraordinary it's been, but especially in digital health and health IT and digital medicine.
Sure, absolutely. So over 25 years in the industry, started as an epidemiologist and public health professional working for PAHO, which is the Pan American Health Organization. The World Health Organization is broken into global regions, and the region that represents the Americas is the region that I worked for a while and did some contractual work with the CDC and contributed to the morbidity mortality weekly reports. Worked also within biopharma. I was a e-business strategist for Bristol Myers Squibb for several years as an expat in Australia for the Asia Pacific markets. Worn many hats, including the director of heart disease and stroke prevention for the state of Tennessee. So I guess I've kind of seen all different elements of the industry, and have had the good fortune of also working directly in communities, working with migratory farm workers, Aboriginals, such as in the Tiwi Islands of Australia. So, it's an industry and an opportunity. It's been amazing to then take those experiences and combine those with my discipline and background within the tech space as well. And that's what I have done for quite a while and continue actually to do for HP as their global head of digital health strategy. My role at Reach, I'm a volunteer president for the organization, very passionate about the work that we've been doing since 2016 as a global social impact organization that's really focused on improving the overall experience of healthcare for both patients and providers.
So impressive. That's amazing. So really appreciate that. When do you sleep? It sounds like you're basically up 24/7.
I don't get much. This morning I actually teach yoga to seniors online on the Wednesdays and Thursdays at 6 a.m. And last night I worked until about 1, and then I had to be up to teach yoga at 6. And when I was instructing, I kept getting my left and my right confused. I think I got a little bit of sleep deprivation going on, but when I do sleep, I sleep like a rock. So
that's fantastic. And so again, everyone's wanting to know, really your motivation around attending and speaking at HIMSS. That everyone was a little nervous about going. It turned out to be an amazing event with amazing connections made and lessons learned. What was your motivation for going this year?
Well, the biggest thing is that, healthcare doesn't stop. Right. I mean, we know this with the pandemic. It doesn't stop. The issues that are occurring or have occurred have just been exacerbated by the pandemic. So we sort of have, everyone who's in healthcare and even outside of healthcare has a role to play in ensuring that we do as much as we can to continue to improve the overall health and well-being of all people. And, HIMSS is a necessary component of that to really bring folks together to begin to problem solve. Reach is a problem solver as well. And we have a collaborative formal relationship with HIMSS, and we had one as well specifically with the conference. We had some commitments that were in place, including bringing together state officials to talk about their state plans related to maternal mortality prevention. So we in fact had a full day of conversation on that. And couldn't happen without fully participating as we did at HIMSS21.
That's brilliant. That's absolutely fantastic. And I think that goes toward the need to attend these sorts of events that are coming out this fall and next year, obviously. And the fact that they can be done safely. I don't know if you've heard of anyone. I've talked to dozens of folks who attended in putting this one session together today, and not had either them or any of their colleagues or friends talk about having come down with COVID. Now it's just 2 to 3 weeks after the event now, so that's really promising about how we can actually travel to meetings and conduct meetings without actually being affected by the virus. What are some of the key learnings that you picked up from attending in person that you couldn't have picked up by doing something virtually? What were some of the key lessons learned from your perspective?
Yeah, I think some of the elements were really centered around sort of the change in climate. I think we get some of that in the digital space, but I think it becomes very real when you're in that sort of face-to-face environment where the tone sort of shifted to some very looking for some very pragmatic approaches to dealing with problems. The other thing that became very apparent, that in this notion of wanting to be more solution-oriented, that folks are really looking for how can I simplify the process of not only getting started, but essentially expanding what I have already begun. And that's a lot of what the conversations became about. The other thing I would say is that, I love HIMSS. I've been a member of HIMSS for, I don't want to say decades because it ages me, but, I'm going to say it. And the truth of the matter is that, HIMSS as a conference has grown significantly. And it comes to a place where if you want to be seen, you show up at HIMSS. But this year was a little bit different. This year was more of, look, if you want to get some business done, you come to HIMSS. And you really did have that more intimate opportunity. A lot of decision makers, a lot of folks willing to sit down and have the luxury of time. They could afford the time to really have a conversation with you, to see folks open up, not only about the challenges of their organizations, but also to be able to open up personally, one-on-one, where some of the level and degree of connection that was made at HIMSS this year that, quite frankly, I haven't seen in the past, because normally, you're lucky if you've got a time to, to shake a hand or maybe, 10-minute conversation. But we were able to really go a lot deeper in the discussions, whether that was in group or in one-on-one. And that was even true in the way that we leveraged the digital aspect of the conference as well, at least for our session.
That's wonderful. Yeah, and I'd love to hear a little bit about that as well. But again, we talked a little bit about this in prepping for this session here, but what was the one piece of advice that you picked up? Again, you're talking about how people are going to be a little bit more open to talks freely when they're face to face. What was the one piece of advice that you did pick up at HIMSS in Las Vegas this past month that was really struck you as being invaluable?
Yeah, I think that it was really centered around so a lot of what I was focused on, again, representing Reach at this conference, is in relation to health equity, social determinants of health, approaches and ways by which to go about sharing and collecting data. And so some of the conversations and the meetings, the sessions that I attended, were centered around the data collection process and understanding who are some of the folks that you need to have at the table to participate in that, who are non-traditional from the healthcare sector, that are yet instrumental in being able to ensure that we can accommodate and address for some of the challenges that we see when folks are entering into the system who have traditionally lacked access to the resources that are available.
That's fantastic. Yeah, and that's the kind of thing that I think everyone appreciates in actually attending something face to face and hearing that kind of detailed background and that kind of detailed advice. Now, talk to us a little bit about Reach and how Reach is helping professionals lead by providing services to folks in need and folks in the digital health and health IT community.
Yeah, so we do it really on 4 levels here. The first of which is on research, and we ask questions and look at situations from a different angle so that we can really kind of get towards addressing some of the gaps that exist between the needs of healthcare administrators, frontline providers, and the needs and expectations, if you will, of patient populations. So just as an example, during the last session where there was a comment that was made around, clinician burnout, that's an area where Reach has been focused. We're not just focused on the burnout aspect, right? We have known that there's been a problem with suicide rates amongst practitioners, and that those rates unfortunately are climbing, and use of substance abuse is climbing. But we're really focused on how can we move towards clinical or clinician resilience, right? So that's a big area of focus of us and for us, and we're doing a lot of work and research as well as developing new innovations within that space. Another area is in the clinical empathy environment. We know that some of the disconnect between providers and patients really not, moving towards the engagement we'd like to see is in part because of the relationship and sometimes the tension between the provider and the patient, the click that just isn't there. How can we change that? And that's not just about the clinician, that's about the provider environment, right? Essentially the entire ecosystem of healthcare and the way that individuals feel or perceive that system and how it relates to them. And so we're doing a global clinical index, clinical empathy index that looks at that. We have a lot of amazing data. All of this is published content that's available from our website and that we circulate as well. And now we're really delving as well into the data science and adoption of data science. One of the interesting things that we note during the pandemic right now is that while we've seen some increase in telehealth, the attitudes and confidence in data science has notably slightly declined, as was shown in the digital doctor survey as conducted by Ipsos Muri, which is a leading global market research firm. And we're now examining that to say, well, why is that? Why is there's this reduction in confidence in data science? And I would say that ties directly nicely into HIMSS as well, is that, I was able to glean some of those attitudes as well during HIMSS. So we want to focus in on that a little bit more, understand provider needs, et cetera. And last, I would say that if, for those who do out there who do know me, know that I'm passionate about the area of maternal health. Certainly the health of women is the #1 indicator of the health and wealth of a nation. And so addressing the issues of maternal health are something that is very near and dear to me, and we focus very deeply in on that. We have a new platform known as Happy Mama. It is the first biopsychosocial wellness platform for maternal health and well-being, and that's a big area where we conduct a significant amount of research as well, both through our innovation, but as well through the Match Coalition, which anyone can participate in, and the Save Moms, National Save Moms campaign. So we do a lot there. We do a lot.
No, thank you, Fran. And it's very clear. You guys are doing amazing work. And again, thank you for your time to not only prep for the session today, but to be here today. And a virtual round of applause from everybody watching around the world. Thank you, Fran.
Thank you.
Well, wonderful, and just incredible learnings. It's very clear that a lot of really important things were learned, lessons were learned at HIMSS21 in Las Vegas, and that a lot of important connectivity was made, and that's critical for things to really take place in terms of the ecosystem evolving rapidly during this pandemic times.